Today I'm going to talk about the different types of injections that you will need to know how to administer being a nurse. The first one is an intradermal injection. And now an intradermal injection may be given for diagnostic purposes. We typically use this for allergy testing or tuberculosis testing. So if you've ever had a mantle given, this is what an intradermal is. So the medication is injected into the dermis and it is absorbed slowly because of the limited blood supply to that area. So when you're giving an intradermal injection, you are going to want to use a smaller needle or even a tuberculin needle or syringe. So tuberculin kind of looks like this. It's kind of more of the brown. And again, we want to use a very small gauge needle. So remember, the gauge of the needle is like the diameter of the needle. So the larger the number, the smaller the needle when we're talking about syringes and injections. So a 26 gauge will work for this. And you also want to have a very short needle, and you can see this one is 3/8 of an inch. Let's see here. Typically, the length of a needle for an intradermal injection is anywhere between 1/4 and 5/8 of an inch in length. The gauge is 25 to 28, and the angle that we are going to inject in is 5 to 15 degrees. So as you are opening up your syringe, your needle, and you can see that this is a very small amount. Now, we don't typically administer any more than 0.1 milliliters of solution in the intradermal, so you don't need a very large syringe. We've talked about having a bevel before, and in order for you to visualize this a little better, I cut a straw so that you can see. So this is how our needles look. Our needles are kind of tapered off and pointy on the one end. And so when you are administering an injection, especially an intradermal, you want to inject what's called bevel up, which would be like this. So if I were to be injecting myself, I would go in like this, and the sharp end here is going to be the first that gets in and pokes through and punctures the skin. Now if I flipped it over, you can see that it could actually just scrape across the skin as opposed to going into the skin. So you want to have the bevel up. And again, it's a lot harder to see in such a small syringe like we have here. But you'll want to take a look at that and make sure that you have that correctly when you administer, especially an intradermal. So I'm going to draw up some of my solution. We're going to just do some practice here. So like always, we want to, of course, have clean hands. And we're always going to want to clean. And then we'll take a new one, right? We're going to pretend, and we're also going to clean the skin. So intradermal injections are almost always done on the ventral forearm. So again, this is the dorsal, right? Think of a dorsal fin of a whale. This is going to be the ventral. Right. So again, we don't draw up very much, so we're only going to draw up 0.1 mils. So I'm going to get the air in first. I've already cleaned my top. I'm going to go in like this. I'm going to inject the air in, and then I'm going to pull back. There we go. Right. And if we're going to use this right away, we don't even need to recap. So again, I'm going to want to make sure I have my bevel up, and you're going to want to hold the skin taut. And again, it's hard with an orange, right? But you want to have the skin kind of pulled out and taut so that you can get in, because you're really only going to go under the skin just very little. So again, remember, the angle that you're going to go in is anywhere between 5 and 15 degrees, so it's not very much. And you're not probably going to be able to see this, but you're going to go in and just under the skin. And then once you have it in place, you're going to hold it steady and you're going to inject in. And if this was in the right place on the person and their actual skin, you would see a little bleb form. It's called a bleb or a wheal, and it's a little bubble essentially of where the fluid is underneath the skin, because again, it's right underneath so you could see it. So Obviously you can't see that on the orange. So, but that is what you are looking for an intradermal injection. And of course you would never recap your needle after using it. All right, next we are going to talk about a subcutaneous injection. Now, subcutaneous injections are given, we give these a lot. Typically, heparin, Lovenox or enoxaparin are going to be the ones you use a lot, and then also insulin are going to be the big ones. And so you're going to give a lot of subcutaneous injections. So typically the length of the needle, the recommendation is between 1/4 and 5/8 inch long. The gauge of the needle is going to be 25 to 27. And the angle is going to be anywhere between about 45 and 90 degrees. And that's going to depend on the person and the size of the person that you are giving the injection to. It depends on the amount of subcutaneous tissue that they have. So we typically end up using the little bit longer needle. That 5/8 inch needle may be used if we're going in at a 45-degree angle. If we're going to be going in at a 90-degree angle, typically that 3/8 inch needle is going to be sufficient. We want to pinch the skin for patients who are thinner. And again, you remember when you are pinching the skin, you're going to want to make sure that when you give the injection that you are not pinching the skin and then injecting this way, because you may actually go through that person's skin and poke your finger on the other side. So once you're pinching the skin, you're going to want to give the injection like this. So then you don't have that chance, or like this if that works for you. But you want to have good control over that and not poke yourself. Massaging after giving injections is not advised, and it can actually damage the tissue or cause hematomas, which is bleeding. So you never want to massage the area. And we do want to avoid the 2 inches around the umbilicus area or the belly button. And you want to be at least 2 inches away from any open areas, scars, scabs, wounds, anything like that. So you do need to kind of be aware of that. So one thing, so again, here's our syringe. And again, this is a 3 ml syringe. And you can see it's a 25 gauge and it's a 5/8 inch. So as you can see here, when you have packages like this, the needle is separate from the syringe. So we do need to hook them up together. Now remember, we want to keep this as sterile as possible because again, we're going to be puncturing somebody's skin and we don't want, we want to decrease the chance of an infection. So what you want to do, so they're going to come apart. They'll be like this. And I'll show you in just a second. But what you want to do is you're going to take out the syringe part. You don't even have to take it all the way out of the package. And right away, while this is still, the needle part is still in the package, you want to put them together. So you're going to push. You barely have to push at all. And then you're going to twist on. All right? And then once you have that, then you can pull the whole thing out of the package. But again, because both this area here and this area here are considered sterile, and we don't want to touch those areas because we don't want our person to get an infection. So when we open up our package, it's like this. So I'm going to open up like this, and I'm going to fold it down. And you can see here, everything is still in the package. I'm going to take this out, and right away, I'm going to put it in here and twist it on. And now I can take the whole thing out of the package. Again, we have our safety thing here. Our needle is the same. You can see there is a bevel there. And it's hard to see, but there is there. And we can get going here. So, same thing as before. Of course, we're going to want to, this is brand new, right? We're going to clean this off. We're going to clean our patient's skin. Typical locations are going to be the fatty areas, because remember, subcutaneous tissue is fat. So the back of the arms, the thighs, and the abdomen as the typical areas that we're going to be giving these injections. So like always, we're going to pull up the amount of air. So if we're going to take out 1 ml of fluid, we're going to take out, or we're going to put in 1 ml of air into the vial. And again, you don't want to put this cap down because once this cap is put down, you cannot recap your needle. So we're going to go in. Push the air in, and then we can flip it up. And again, these smaller needles, right, they're not going to be able to draw up solution quite as quickly because they are small. And again, you want to make sure you get all your air bubbles out. All right. So there we go. All right, so we've already cleaned our person. And again, if we're not putting down our needle, we don't even need to worry about this. So again, it's going to depend on the person in front of you, but we're either going to go in at a 90-degree angle or a 45, somewhere in that range. So again, 90 is going to be just straight up and down, and then 45 is going to be that cut in half. Okay, so I'm going to just demonstrate a 45 since it'll be easier for you to see on the video. So again, with this, we do probably going to want to pinch the skin a little bit. And again, we can pretend that's the belly button, that's the umbilicus, so we're going to avoid that. Obviously, we're not going to be able to avoid it by 2 inches, but we are still going to avoid. Again, with this, if we're doing a 45-degree angle, we do also still want to worry about the bevel. So we want to make sure the bevel is up. So again, to kind of give you an idea of how I'm holding this, I'm going to hold it like this, so you can see my bevel there. So then that part goes into the skin first and pierces the skin. When you're doing a 90-degree angle, it doesn't matter as much, but this 45, it will. Okay, so once you're ready, you want to hold the skin, you're going to hold it taut, and again, you're just going to do a poke in. Once you're in, you could stabilize, and go ahead and just push your solution in, and then you'll go out, and right away, you're going to activate your safety device. Okay, all the way. Again, obviously, you're going to let it click into place. I'm not going to for this video, though. And that's how you give, again, a subcutaneous injection. All right, and finally, we're going to talk about an intramuscular injection. And again, the length of the needle for intramuscular is going to vary on the size of the person, but anywhere from 1 inch to 3 inches the needles can be. Typically, you're going to see 1 to 1.5 inches. The gauge of the needle is going to be a little bit larger, so 21 to 25. And again, it's because we can deliver larger volumes into the intramuscular, so therefore the gauge of the needles are usually bigger. And the angle we are going to go into is 90 degrees, because again, we want to get through the skin, through the subcutaneous layer, and into the muscular layer. There are 3 sites that we give intramuscular injections. The first is the ventral gluteal, and then this is kind of on the side of the hip kind of area. The vastus lateralis, which is going to be in the thigh muscle, and then the deltoid, which is in the arm. So do take some time to learn those sites and learn how to locate those sites, and that is in your Taylor book. So again, with this, you'll notice here the syringe I have. It is a 23 gauge, so you're going to see it's going to be a larger size needle. And this particular one I have is just a 1 inch. So again, you can see all the way up to 3 inches, which is really quite large when you have a needle coming at you. So again, remember these are sterile, so we don't want to touch any of this. So I'm just going to grab this, the syringe part, and hook it up right away into that needle part. Push on and twist, and then you can take it out. So just to give you an idea here, you can see the length of that needle. And I'll grab out my subcutaneous one that we just used, just so you can see the difference. Right. So definitely a difference in you, so you can see it's going to get into that muscle layer. All right, so again, we always want to keep the caps on our needles for as long as possible because we don't want to accidentally contaminate the needle. So if I'm going to be, we're going to stick with our 1 ml injection. I'm going to pull up my 1 milliliter of air. And then again, I'm going to have a clean alcohol wipe, and I'm going to clean that, and I'm going to clean the person's skin. And remember, you want to locate your landmark first, and then you're going to clean with a rotating clean, starting from the center and moving out. And you don't want to go back in once if you've gone around and gone out, because we don't want to pull any germs back into that area. Okay, so that is clean. And then, like before, we're going to inject our air into our vial. We're going to flip it over. Get all the air out. So same thing before, like before, if we're going to use our needle right away. Otherwise, there it goes, like this, and I could cap it. So, but we're going to just draw this right up at the bedside. We've already cleaned our skin, and then we're going to be ready to go. So 1 to 5 mils is the recommendation for the ventrogluteal and the vastus lateralis sites. You can inject all the way up to 5 mils, which if you think about it is a lot because this is only a 3 mil syringe. So it could potentially, usually I typically only see, 1 mil to maybe 3. For the deltoid, it is a smaller muscle, so you can't inject quite as much. So 1 to 2 mils is going to be the most you're going to inject into the deltoid muscle. In the past, we've also used the dorsal gluteal site, and that is no longer recommended. Now, you will still see nurses out in hospital settings and stuff use the dorsal gluteal site, but research and best practice indicates not to use that site due to the increased risk of complications, hitting nerves, pain for those sites. So we do not use those, and I'm not going to teach you that. So again, the needle is going to be going in at a 90-degree angle, and it's going to be perpendicular to the body. Okay, so if again this is our body, we're going to go 90 degrees in, so we're going to be going straight in. We use what's called a Z-track method, which is recommended when giving intramuscular injections. And that is where you, if I was going to be giving the injection on myself here, and say this is the part where I'm going to give the injection, I want to pull the skin down, give the injection, and then let the skin go back into place. And so it kind of locks the medication in the muscle when we displace the top layer of skin and tissue, give the injection, and then let it kind of fall back into place. So that's what's called a Z-track method, and that is what is recommended. So, all right, so I've already done this. I've cleaned my skin, I've cleaned my site, I've checked all my stuff. And again, it's going to be really hard to show that Z-track method on this orange. But if I were to do the Z-track method, again, I would pull this skin down, right, or pull it this way, pull it taut, and then you're going to just jab in. So, and again, you do want to do a rather quick jab and go through, because I have actually had, and then when you pull out, pull straight out, where you've gone to the skin and it bounces off. So sometimes people's skin is a little bit thicker, and of course you're never going to recap your needle here. You're always going to just activate the safety thing and get rid of it that way. So quick jab into the skin, go through. Again, if you do go in, and there's a good chance at some point in your career you will end up hitting the bone, depending where you give the injection. But if you give a deltoid, you may hit the bone, and all you need to do at that point is just back it up a little bit and then go ahead and administer. In the past, they have recommended to aspirate. And so what aspiration is, say I have my medication here, and I've poked it in for an intramuscular. What they had recommended is that you pull back, and if you got blood up into there, that would mean you were in a vessel, a blood vessel, and so then you would want to pull out your needle a little bit so that you didn't inject the medication right into the vessel. So that is called aspiration, and they do not, they no longer recommend that we do that. The chance of actually having it in a blood vessel is very small, and it just is no longer recommended. So you do not have to worry about that, but just be aware that you may still see nurses out in practice doing that. So I hope that is helpful for you, and good luck on your future injections.